Hi there, I'm Dr. Benfield, I'm a GP, and this video looks at having a written asthma plan for when your asthma worsens. It's really important because it's been proven to reduce the risk of ending up in hospital with severe attacks. Everyone's slightly different, but usually worsening asthma will mean tighter, wheezy sounding breathing with the sensation of not being able to take a full breath. You may feel more short of breath at activities that are normal for you, a cough that could be triggered by activity or other triggers like cold air, being woken at night by a cough, and needing to use your reliever inhaler more. You can also have a peak flow meter at home to help guide how bad your asthma is. If you don't have one, please ask your GP to prescribe a peak flow meter for you. You'll need to do it a few times when you're at home completely well to know what level is normal for you. It's important for you to know what level of symptoms will be for triggering your action plan and what would trigger immediate emergency action. If your peak flow result drops to lower than 80%, then you need to start your action plan. If it drops below 50%, then this is an asthma attack and you'll need to seek help immediately. If ever your asthma symptoms are worsening, you need to have a plan ready for this. If you don't have a plan, please discuss an action plan with your GP or the asthma nurse. You'll need to contact for advice if you notice asthma symptoms worsening and you don't have a plan, or symptoms worsen despite the plan. The urgency for contact depends on the symptoms. If the symptoms are affecting you a lot or they're worsening quickly, you'll need to speak to someone the same day. At the appointment, we would try to work out why your asthma was worsening or why it's not well enough controlled. A common reason is not having a good enough underlying control of your asthma. If your normal asthma causes you to regularly need to use your reliever inhaler more than 3 times a week, and that would be the blue one on the old regime or extra combination inhaler on the new regime, then it means your asthma is not well enough controlled. Remember, we're aiming for total control, no symptoms ever. The preventer inhaler works gradually over a few weeks, and it only works if you use it. Hay fever is a common reason for asthma worsening. There's a separate video on this, so if you have asthma and hay fever, please watch this video. If you have the aerosol type inhaler, it might be that not enough steroid is getting into your lungs. So an easy thing to do for this would be to start using a spacer device with the inhaler. If you don't have a spacer at home, ask your GP to prescribe a spacer for you. An alternative would be to switch from the aerosol type to the dry powder type inhaler. The commonest plan for poor control that is stable or only gradually worsening would be to increase the regular steroid component of your regime. And this would usually be to increase the number of regular morning and evening puffs per day. If you're not using your preventer inhaler regularly morning and evening, please start to do this. If you take 1 puff in the morning and 1 puff in the evening, increase to 2 puffs twice a day. If you have the brown inhaler, you could increase the dose to 3 puffs in the morning and 3 puffs at night for a couple of weeks. But if it's not in your plan that you've previously discussed, let your GP know you've done this and book an asthma review. If you use a combination inhaler already at 2 puffs twice a day, then you might have to have the inhaler stepped up so it has a higher steroid per dose. And remember, this is okay because it reduces the risk of needing the really big doses that you get from steroid tablets for severe attacks. If your breathing symptoms are worsening, the other thing to consider is, could this be something else and not asthma? If you're feeling more short of breath but it doesn't feel like your previous asthma flare-ups, an extra blue or combination inhaler hasn't altered your symptoms, it may be something else. Commonest reason would be a chest infection. So if you're getting a temperature, the cough sounds more productive than your normal dry asthma cough, think of that. At your review, there are some other asthma treatments that we might consider. Or you might need a referral to the hospital team if the symptoms are not well enough controlled despite all the treatments we can give as GPs. Everyone with asthma should have a written asthma plan. And I'll put a link for an asthma review sheet on our website for you to print off if you don't have one. On this sheet, you can write your usual regime, what symptoms and peak flow readings will trigger an increase in your steroid use or other action plans, what would trigger contacting for an urgent review, and what would trigger immediate assistance. This sheet needs to be discussed with your GP or asthma nurse. You can't just do it by yourself. It has to be discussed with the team. Okay, I hope you found that useful. Thank you for watching.